Let's get started with just give us a picture of how bad the situation has been during this pandemic for migrant workers.
Thank you for having me on the program. Migrant workers were amongst the worst affected in Southeast Asia with the pandemic. In August, when the infections were at the highest in Singapore, 90% of the infections were migrant workers living in dormitories. Similarly, in Thailand, when they had their second wave, there were a lot of migrant workers in the seafood and fishing industry who were affected. In Malaysia, there have been a lot of migrant workers impacted in the Middle East as well. There are various reasons for this. One is the nature of the work. Many migrant workers are essential workers. They have to continue working during lockdown periods. There have been some bad examples of employers not providing sufficient protection, personal protection equipment, or allowing workers to socially distance. There have been one issue that has come up very vividly during the pandemic is the substandard and inadequate housing and accommodation. They have been living in close quarters, crowded conditions, and also in terms of social protection and income support, they have not been treated equally with.
So have we seen any changes then, especially both from the private sector as well as perhaps government intervention?
Well, it's been a year since the pandemic started impacting Southeast Asia, and there has been changes. First of all, there has been a robust health response. So in terms of testing and now even the rollout of the vaccines, I think governments have realized that migrant workers need to be treated equally with nationals. They make a big contribution to the economy. You know, in Singapore, migrant workers comprise 38% of the workforce. And similarly, in other countries, they make a big contribution to certain sectors. So from the health side, there has been a robust response after lessons learned. And also with regards to accommodation, there has been a realization that the standards, minimum standards for employer-provided accommodation should be improved.
Nilim, what about public sentiment, right? Because governments are ultimately, at least in some part, beholden to what the public thinks. And the International Labour Organization has done surveys that show a distinct lack of public empathy for these migrant workers across Asia. Do you think that could change post-pandemic?
I think that's correct. Public attitudes towards migration, migrant workers is very important. And we have done surveys in the region in Thailand, Singapore, Malaysia, as well as Japan. And what we have found in Thailand, Malaysia, and Singapore in certain areas, it is not supportive. For example, majority of respondents in our survey found that migrant workers should not receive the same pay and benefits as nationals, where in fact, they should have the same employment and working conditions. Then there is the treatment of undocumented workers. In the pandemic, there has been cases where undocumented workers were housed in, detention facilities, which was crowded, and then they were resulting infections. And the public attitudes towards undocumented workers is generally that they should not, they are not entitled to rights. However, with regards to undocumented workers, while the state has the right to control its borders and take measures to reduce irregular migration, undocumented workers have the same labor rights. If they have been working, they're due the wages and benefits, so that should be recognized. Here, I should say an important development in the region has been in Singapore from the highest level, from the Prime Minister downwards, the recognition of the contribution of migrant workers to the economy and improving the quality of life of Singaporeans. So that is very welcome.
Nilim, just before we let you go, are you hopeful that the rollout of vaccines, the access to vaccines, will be done in an equitable way in terms of it being provided to these migrant workers across the region?
I think there is a realization that whereas public health is concerned, everybody has to be treated the same because then there's an interdependence. And if there are infections among migrant workers, it affects the country as a whole. So there are announcements in Malaysia, in Singapore, as well as Thailand, that in the vaccine rollout, migrant workers will be treated the same. They'll have the same access as nationals.